Go to a specific location and dig a ditch all day, and you will get paid whatever non-negotiable amount of digital cryptocurrency credits that they choose into your account. If you don't do it because you don't want to be a ditch digger, the nanosmart dust sensors inside of your body, broadcasting your every location, movement, and biometrics back to the government AI through the wireless 5G sensor interfaces, will give you away. Your social credit score will be lowered to restrict all allowed activities and travel possibilities, and you will receive no digital currency credit in your account as punishment for failing to complete the task you were dictated. As Klaus Schwab put it, you will own nothing and you'll be happy about it. As George Orwell put it, if you want a vision of the future, imagine a boot stomping on a human face forever. Aside from all of that good family fun, a 2018 article in Science Daily stated new research by scientists shows that when cellular barriers are exposed to metal nanoparticles, cellular messengers are released that may cause damage to the DNA of developing brain cells, meaning brain damage, during their interactions with cell membranes and the internalization into cells, altering key signaling pathways and processes. Which brings us to Part 2, the mRNA vaccine, anaphylaxis, and AIDS.
Rocco, let's make sure we're clear on something. Let's stipulate that this is not a vaccine.
Right.
I mean, we need to be really clear. We're using the term vaccine to sneak this thing under public health exemptions. This is not a vaccine. This is a mRNA packaged in a fat envelope that is delivered to a cell. It is a medical device designed to stimulate the human cell into becoming a pathogen creator. It is not a vaccine. Vaccines actually are a legally defined term, and they're a legally defined term under public health law. They're a legally defined term under CDC and FDA standards, and a vaccine specifically has to stimulate both an immunity within the person receiving it, but it also has to disrupt transmission. And that is not what this is. They have been abundantly clear in saying that the mRNA strand that is going into the cell is not to stop transmission. It is a treatment. But if it was discussed as a treatment, it would not get the sympathetic ear of public health authorities, because then people would say, well, what other treatments are there? The use of the term vaccine is unconscionable for both the legal definition term of it, but also because it actually is the sucker punch to open and free discourse. Because by saying vaccine, you dump it into a thing where you could be anti or pro the therapy. But if you actually talked about it as a therapy, remember, and people forget this, Moderna was started as a chemotherapy company for cancer, not a vaccine manufacturer for SARS. If we said we're going to give people prophylactic chemotherapy for the cancer they don't have, you'd be laughed out of a room because it's a stupid idea. That's exactly what this is. This is a mechanical device in the form of a very small packet of technology that is being inserted into the human system to activate the cell to become a pathogen manufacturing site. And I refuse to stipulate in any conversations that this is in fact a vaccine issue. The only reason why the term is being used is to abuse the 1905 Jacobson case that has been misrepresented since it was written. And if we were honest with this, we would actually call it what it is. It is a chemical pathogen device that is actually meant to unleash a chemical pathogen production action within a cell. It is a medical device, not a drug, because it meets the CDRH definition of a device. It is not a living system. It is not a biologic system. It is a physical technology. It happens to just come in the size of a molecular package. So we need to be really clear on making sure we don't fall for their game, because their game is, if we talk about it as a vaccine, then we're going to get into a vaccine conversation. But this is not, by their own admission, a vaccine.
So, Judy,
as a result, it must be clear to everyone listening that we will not fall for this failed definition, just like we won't fall for their industrial chemical definition of health, because both of them are functionally flawed and are an explicit violation of the legal construct that is being exploited.
So what should I be referring to it as? A chemical agent, or?
Correct. It's a synthetic pathogen. They've literally injected the very pathogenic part of the virus into every cell of the body.
When you say pathogen, that says to me it's going to make me sick.
Correct. So
it is made to make you sick, Rocco. Rocco, remember that 80% of the people allegedly exposed to allegedly SARS-CoV-2. So let's not get into that rabbit hole, but 80% of the people who are exposed to allegedly the virus have no symptoms at all. They're called asymptomatic carriers. 80% of the people who get this injected into them have a clinical adverse event.
Correct.
Right.
You are getting injected with a chemical substance to induce illness, not to induce a immunotransmissive response. In other words, nothing about this is going to stop you from transmitting anything. This is about getting you sick and having your own cells be the thing that get you sick.
Correct.
So it's gonna trigger an autoimmune response?
It can, and it can.
Among many things.
Among many things. It can actually directly cause multiple sclerosis, Lou Gehrig's disease, Alzheimer's disease, because that's what the expression of that pathogenic envelope. It can cause accelerated cancer.
What Dr. Martin, Dr. Mikovits, and Dr. Andrew Wakefield are pointing out, an mRNA COVID-19 vaccine is not a vaccine at all. It doesn't elicit an immune response. It has to be turned into a foreign protein or antigen, meaning poison. And it's this poisonous foreign protein, in turn, that creates your natural immune response. A messenger RNA quote-unquote vaccine is actually genetic engineering. You'll have your own genetically reprogrammed cells in your own body that will produce poisonous proteins to which your immune system will mount an immune response against. That's called an autoimmune disease, which used to be called AIDS. The potential for this to go horribly wrong is enormous. At the end of this film, we'll show you the alarmingly high cases of death, paralysis, tachycardia, pruritus, delirium, hyperpyrexia, and anaphylactic shock from these new mRNA injections that are being hidden from you by the media. But why is this happening to people? Our bodies have a biological intelligence that considers any foreign non-self protein, meaning antigen, meaning poison, that is not made by our own cells to perform a function needed by our body as a toxic foreign intruder, and is designed to destroy and remove that poisonous protein antigen. Our DNA has 4 nitrogenous nucleic acid bases, meaning made of nitrogen or nitrogen-like, that combine in varying combination sequences of these bases to code for the creation of specific proteins our bodies need to make. Our mRNA, or messenger RNA, is the go-between instructional codes that tell the ribosomes in our cells how to link different amino acids together to form a specific needed protein by the body. What these new, untested Frankenstein human genetic modification injections are actually doing is inserting a new messenger RNA coding sequence into your body's cells that instructs your ribosomes to create a foreign microbial protein, meaning antigen, meaning poison, that has no business being inside your body. So your body will go into anaphylactic shock and attack it. If you are wondering why people are dropping dead or getting severely sick, go pet an angry rattlesnake or king cobra and see how your body reacts after venomous foreign protein antigens enter into your bloodstream. Only now, your own cells are programmed to constantly inject venom into your interstitial fluids.
And that's how people get the only way people can get swine flu is if they've taken animal, the pig tissue, grown it in a solvent, toxic environment, and then these swine cells create a virus to break itself down.
Okay. Now let's.
You can inject it into a human, and then you will find those actual swine tissue in there. It's just you have a waste product, and now the body has to clean that waste product out of the body, and it's going to be very alarmed because you've got foreign tissue in there injected into the body.
Okay.
That's why Guillain-Barré disease, that's why anaphylactic shock occurs when you inject people with foreign debris, foreign tissue. It goes into shock. It can even die from the shock of foreign tissue being injected into you.
Okay.
The COVAIDS mRNA vaccine is designed to give you an autoimmune disease, which is caused due to different alterations in the immune system, which are triggered by the exposure to various exogenous and endogenous antigens or poisons. Exogenous means poisons from outside of your body, like an injection. Endogenous means poisons created inside of your body, as this injection programs your own cells to create. They are admittedly and literally giving you AIDS. It is a false debunked logical fallacy that there was a difference between an autoimmune disease and AIDS, because you caught the fictional AIDS virus exogenously from shagging a monkey and then sexually transmitting it to another human. Nobody shags monkeys, and AIDS is not contagious. You and even your babies were injected with the AIDS antigen. You didn't catch it. In fact, hundreds of normal medical conditions trigger a false positive AIDS test, which is just a poisonous antigen detection test. You may think you have it, but you don't.
Makes perfect sense. Now, you say that AIDS was created in a laboratory.
Yes, in UCLA, University of California, Los Angeles, 1961 and 62, they created a mixture. What they did was combine the waste product, the virus of a bovine, the lymphonomic virus of a sheep, and the leukemic virus of a bovine. The way you can only get a virus, like I said, is if the tissue is so toxic with chemicals that bacteria can't do their normal janitorial work and eat the organic tissue and then reduce the waste and eliminate little waste. When your body makes a solvent, the way which is a virus, a solvent is a virus, it's a soap, it's not alive. There's no nucleus, no respiratory system, no digestive tract, no circulatory system. There's none of that. So it's not alive. It's a waste product.
Right.
It's